A lot of times we might have patients here who are on a behavioral health hold.
The small emergency department at Glenn Medical Center is shutting down in a week.
A lot of people aren't in the position to wait until the very last day.
Walking through the quiet and at times dark halls, Hospital Administrator Lauren Still says the facility is taking fewer patients and staff is winding down as the medical center overall prepares to close October 21st. She says the federal government will no longer consider it a critical access hospital, meaning the loss of a key lifeline of funding. Critical access facilities need to be more than 35 miles from the nearest hospital. The medical center is 32 from one in Colusa County.
Rural healthcare is not for the faint of heart. We are constantly up against staffing challenges, funding challenges, resource challenges, and we have to think creatively in a lot of ways just to keep our doors open on a daily basis. What allowed us to keep our doors open on a daily basis is that critical access designation.
It's a terrible situation.
Republican Assemblyman James Gallagher, who represents the area, says its closure is part of a deeper problem impacting rural hospitals in California. These providers often care for lower-income people who are on the state's Medicaid system, requiring the state to reimburse. But those reimbursement rates that are set by state lawmakers have not been enough to cover costs, on top of other requirements state lawmakers have placed on the healthcare industry overall.
With Medi-Cal not paying what it costs to serve the public, and with Medi-Cal essentially going bankrupt because of bad policy decisions by the Democrats and Gavin Newsom. So, the blame, really needs to go at some of these policies that have really undermined the ability of rural hospitals to survive.
Glenn Medical Center is one of several rural hospitals that have been at risk. Others are in Inyo, Modoc, and San Benito counties.
I shouldn't have almost 2 counties with no hospitals.
Republican Assemblyman David Tangipa represents the area that includes Southern Inyo Healthcare District, a hospital that's now out of money.
The doors are open, but there is a very real possibility that people will just show up one time and they just no longer will be able to work. And that is actually the sad reality of a lot of hospitals across California. When they did an expansion on Medi-Cal, they expanded a broken program without fixing the issues that our hospitals are going through when it comes to the utility costs, insurance costs, employee payroll tax, that we expanded a program that doesn't reimburse properly.
The solution to keeping some of them open, including Glenn Medical Center, could require state and federal leaders, Democrats and Republicans, working together.
It's hard to say what any one person could have done differently. This comes down to technicality and the federal rules. And right now, the state of California and the federal government are not on the best speaking terms.
We reached out to Governor Gavin Newsom's administration and the California Health and Human Services Agency for comment. A spokesperson there said, in part, it continues to be in coordination with hospital leadership and offer support to rural health care providers. This includes expediting state payments when possible. The spokesman went on to say it's unfortunate the federal government decided to significantly defund providers, saying that that's resulting in an even more stressed health care system.
So let's talk about the current federal spending plan, often known as the Big Beautiful Bill.
Right.
How does that factor into all of this?
Well, at this very moment, it doesn't, because that bill doesn't take effect until October 1st. The rural hospital issue is something the state has been grappling with for years, but all sides acknowledge that those cuts to Medicaid won't help the situation. That bill does include funding for rural hospitals, but in the case of Southern Inyo, for example, it would just be too little, too late. But again, I want to emphasize this debate has been going on for years at the state capitol since I've been covering it. There was a loan that was passed in 2023. This is something that will continue to be an ongoing discussion.
And during that time, we've seen the erosion of care in these communities. Yeah,
exactly.
It's really important. Thank you.
All right, Ash.